So, cholesterol is a substance that's naturally produced by the liver. It's also available in food. It's used by your cells. It's actually part of the makeup of your cells. And it's also part of the hormones that are produced by your organs. Cholesterol is also present on top of the nerves, it's in the neurons. So, it just is important for the integrity of the organs and the hormones. My name is Dr. Mahmoud Al Rifai. I'm a cardiologist at Houston Methodist. Cholesterol can we commonly use total cholesterol, HDL cholesterol, and LDL cholesterol to it kind of gives different components of cholesterol. So total being the total component of the good cholesterol, which is the HDL, and the bad cholesterol, which is the LDL. So commonly total cholesterol we want it to be less than 200. LDL cholesterol is a bit of a nuanced threshold for defining low versus high, but commonly less than 100 in most people. And then a good high LDL cholesterol is commonly defined as more than 50 in females and more than 40 in males. So anything that is not within those categories will define as abnormal. And then obviously there are categories of abnormal being moderate to severe. Commonly, high cholesterol does not cause symptoms. Now, in extreme forms of high cholesterol, such as those that are genetic, there's an entity called familial hypercholesterolemia, which is characterized by severely elevated LDL cholesterol. Such patients may actually experience cholesterol depositions in their eye. They can see it in the cornea. They can see cholesterol deposition in the tendons, but these are extreme cases. For the most part, cholesterol doesn't have symptoms. Now, of course, cholesterol in high levels can cause plaque buildup. Plaque can deposit anywhere in the body. If it deposits in the heart, it can cause a heart attack. If it deposits in the neck arteries and the brain arteries, it can cause stroke. These are the endpoint. But high cholesterol in and of itself does not really cause symptoms. So if you have a family history of heart disease and stroke, so multiple first degree relatives like your mom, dad, siblings, uncles, grandparents, if you have multiple family members who've had heart disease or stroke, especially at a young age, so less than 50 for men, less than 60 for women, and different studies quote different cutoffs, but especially the family history of heart disease and stroke at a young age was called premature family history. I think those patients probably have some kind of genetic predisposition to having heart disease and stroke due to cholesterol. I think those are the kinds of patients that we need to be very careful about screening early and then treating early as early as possible. Patients who are overweight or obese, those who don't exercise, those who don't eat well, I think it's also important that those patients get screened and counseled not only on adhering to good lifestyle therapy with diet and exercise, but also potentially starting them on a statin if it's appropriate. So unchecked high cholesterol, so that's not treated with medication or with lifestyle therapy, especially if you have other risk factors on top like smoking, diabetes, high blood pressure, can slowly lead to plaque deposition. Now, as cardiologists, what we mostly are focused on is the heart and the brain because we want to prevent having heart disease and stroke, heart attack or stroke from happening. So plaque deposition can happen over time because cholesterol cells can penetrate the lining of the arteries, whether it's in the heart or the brain or the kidneys, anywhere. They go into the cell and then they can cause a small inflammatory reaction that can lead to plaque buildup over time. And that plaque can increase in size. And the biggest effect that when it increases in size, it can cause plaque eruption. And that plaque then will just basically clog off the supply of the artery. So if that artery happens to be in the heart, a clogged off artery will cause heart pain and stroke and heart attack. And if it happens in the brain, it can cause stroke. If it happens in the kidney, it can lead to chronic kidney disease over time. So plaque buildup over time can lead to end organ damage, and that's why it's important to not only screen but treat and follow up treatment over time.